Hi, I'm Joanne Jones, and I've been a Dentistry Today continuing education leader for the last 10 years and a practicing clinician for over 3 decades, where my focus and my passion has been bringing dental health education to Canadians. I've always kind of said that the mouth is a mirror to the body. And actually 7 out of 10 Canadians will have a form of gum disease, in fact, at some point in their lifetime.
Now, more than ever, taking care of our teeth at home is of the utmost importance.
So as far as recommendation for toothbrush size, it's important to have a toothbrush that really conforms to the anatomy of your teeth, and also to make sure that you replace that brush a minimum of once every 3 months. If you are using a rechargeable toothbrush, it's a great idea to find one that actually has a pressure sensor on it, so you'll be able to know immediately if you are applying too much pressure. And also another great feature of some rechargeable toothbrushes is the opportunity to be able to let you know when it is time to replace that toothbrush head for optimal benefit. And another feature of a toothbrush that is very, very important and essential is to use a soft bristled toothbrush. When you've had something to eat or drink, what happens afterwards is the pH of the mouth tends to drop and go very low, so it becomes a very acidic environment. And a lot of times we get in and we scrub really hard, which can do considerable damage to the enamel in that acidic environment. It's also really important to have a routine. So what I often suggest is make sure that you floss or use some sort of device to clean in between your teeth first, and then brush twice a day for a minimum of 2 minutes.
You know, my smile is my trademark, and having white teeth is just so important to that. Yeah, I basically brush my teeth in the morning, after breakfast, of course, after I have lunch, and definitely after dinner before I go to bed. 3 times. I try to also floss in there as much as I can. So I've been using the Phillips Sonicare rechargeable toothbrush for a while now, and I love it. You know, obviously, like most of us, we grew up using the manual toothbrush that our dentists give us, but I noticed I was having issues because I'm an aggressive brusher. So I don't even have to worry about any of that stuff anymore. With this Phillips toothbrush, I just, you put it in the different quadrants in your mouth and it does all the work for you.
Do not share toothbrushes. Make sure that they are spaced apart and not in contact with one another. Let it air dry. And again, make certain that you change that toothbrush a minimum of once every 3 months.
Great lesson. So let's get the brush in your mouth.
And I did not know that.
Turn it on.
Often in clinical practice, I would be asked about the importance of baby teeth. And it was always so essential to help parents understand that the baby teeth are basically creating a nest or a home for the permanent teeth. Some of the other things that are really important with our teaching to our children as a parent is to make sure that we communicate very positive dental experiences. We want to establish a routine. We want to make it fun. We want to choose a toothbrush that has some fun to it and some interactions. And it's a great idea to be able to do this together.
You give them a toothbrush, you tell them exactly what to do, they start brushing. So I began singing songs, Jingle Bells, Happy Birthday. It was fun. Now, by using the Phillips Sonicare rechargeable toothbrush, they love it because they love the little images on there. They love definitely using the app.
So how do we get children to brush for 2 minutes? The Sonicare for Kids toothbrush actually has a really cool aspect to it regarding timing. It starts out for the children with a 1-minute timer, and each time that child uses the toothbrush, it incrementally increases the amount of brushing time. Regular professional dental cleanings are so vitally important. Often oral disease, whether it's gum disease or whether it's cavities, are often symptom-free until they are in the later stages. The other thing is that oral health is so closely related to overall health. So no doubt a few things have changed over the last while with the present coronavirus pandemic. You can be assured that when you return to the dental office that there are even higher levels of infection control that have been put in place for your safety.